We're here to remind everyone about this sickle cell disease. I'm going to be very brief here so we can move to my colleagues. Maryland has supports, but we can do better, especially here in Montgomery County. A couple things I want to lift up that you might not hear, and thanks the Red Cross for being here. First, donate blood, please. Get screened for the sickle cell trait, if you're Black or African American especially. Less than 10% of Americans donate blood, but blood transfusions are the most critical treatments for someone with sickle cell. And patients benefit most from blood transfusion from people of the same race or ethnicity. But only 5% of blood donators are Black. So just a reminder, especially please sign up. And I know the Red Cross will appreciate that. Thank you for all that they've done. They've done 7 specific Red Cross donations for sickle cell in the area, and they have a big presence. So please sign up. Also engage with these great programs that are here. The National Disease Association of America, the Maryland Sickle Cell Disease Association, African American Health Program, all great choices to learn about how to better help folks be aware and manage this disease. Now I'm going to turn to Councilmember Sayles, our lead for health disparity elimination, and Councilmember Albornoz, and then we will hear from some of our speakers briefly, and then we'll read the proclamation. Councilmember Sayles.
Thank you to my colleagues for joining us to recognize Sickle Cell Disease Awareness Month. Roughly 100,000 Americans have sickle cell disease. And as Councilmember Jawando mentioned, it's impacting Black and brown populations disproportionately. Earlier this year, advocates wrote to my office, and we've been meeting regularly to talk about the resources and the response here in Montgomery County, especially in our emergency rooms, where we know we have many challenges. So please stay tuned for the recommendations and advancements that we are pushing for from our office. I'm so grateful to our advocates and our partners, especially at the Department of Health and Human Services, who are working very hard to address this disparity. The FDA actually approved 2 milestone cell-based gene therapy treatments for sickle cell disease at the federal level, signaling critical advancements in finding a potential cure. Early screenings, quality care, and access to resources and treatments within our county's borders needs continued investments, reminding us of our collective responsibility to address sickle cell disease at the root cause. And it's going to take all of us, and so I'm glad to have so many advocates here today. Thank you.
Thank you so much, Councilmember Sayles. Thank you, Councilmember Jawando. So this is unfortunately yet another example of a disease in our country that disproportionately impacts our Black community and not far behind our Latino community. And when I look behind me, though, and I see these extraordinary leaders from so many different sectors of our community, it gives me hope that we can do a better job of raising awareness, ensuring treatment, but also finding a cure for this terrible disease. And it is going to take all of us working collectively together. I want to especially uplift Mrs. Janet Ricks, who we will be hearing from soon. And between her and Vernon, I don't know of any couple in Montgomery County that has done more for this community over the years to make it the wonderful place that it is. And that also gives me hope for our future. And lastly, I want to uplift our faith community. We have many pastors here behind us, and the important role that our faith community plays to support love and guidance for people who are inflicted with this disease and others, but also as advocates, and to make sure that we come together as a community, because we need a higher power to make sure that we get where we need to go. And I can't thank all of you enough for your commitment and dedication. So I think better days are going to be ahead, thanks to all of you. Thank you so much.
Thank you so much, Councilmember Albornoz and Councilmember Sayles. All right, now we are going to hear, she's had a great lead-in from Ms. Ricks, who was recognized as one of the oldest people living with, even though she doesn't look like it at all, with sickle cell in the country. Come on up, Ms. Ricks, and just tell us a little bit about your journey, and just thank you for being here. This has become a tradition. Let's give her a round of applause.
Thank you very much for having me. Yes.
I'll put it here for you. Okay. Because I know you got your books.
I'm glad to be here, and thank you, Will, for having me. Thank you very much. We love you. It's interesting. It's fun to be a patient sometimes and to be recognized, and I respect that. I respect all of you that came to witness this. For sickle cell, it's an interesting thing. Some things have been said, and I just learned 100,000 people, not 80,000 people, like this book says. Anybody who is involved in the sickle cell movement should have this book. I, as a patient, knew very little about what was the problem with me. I have sickle thalassemia, sickle cell anemia layered on top of thalassemia. Even the doctors know very little about that, but I'm learning as I speak. And I got this book last year, this time of year, in Sickle Cell Month, when I went to California to be at a sickle cell summit. And the lovely lady that puts on that summit has done it for 16 years, is doing it again this year. Our Dr. Gadsden, who is here,
She's coming up next.
oh, she's coming up in a minute, was honored there. And several of the pieces of literature that I was handed, I show her picture, but more importantly, in the Jet magazine, which you all know that's defunct now, there was an article on Dr. Marilyn Gadsden, and she was very instrumental in involvement with the sickle cell disease. So I encourage those that are here to be aware of that. And talking about awareness, please be aware. There's a person here in the state of Maryland that we just lost. His name is Donald Cash. Donald was president of Faces of Our Children. Faces of Our Children was a sickle cell awareness program. They gave scholarships and they gave some monies to families in need who had children suffering from sickle cell. And we should be all aware of that. The other thing that was mentioned was the when I go to the hospital, it seems to me the first thing I get is a blood transfusion. We as African Americans need to be aware of that and give blood to the American blood community. And there are religious organizations, Mount Calvary is one of them, who do interesting things around sickle cell and around the blood and do blood donation programs. We hope that you will be aware of this and participate in the things that are offered in our community. Thank you very much. My age...
Vernon. You don't have to.
That I have no problem answering that. I'm very happy, as a matter of fact, to answering that because he's 85. I'm not too far behind him. I'm 82 years old. Yes. Thank you.
God bless you. Thank you so much. And good to know, Vernon. I hope you eat tonight, brother. We're going to have up now briefly here Dr. Gadsden, who was aforementioned, to share brief comments. Dr. Gadsden.
Thank you, and good morning. And Vernon, you're 85, I am too. We have to have a celebration, okay? Back in the early 70s, I had two friends of mine that started a program in New York for families with sickle cell disease. And the point of their program was to really learn what families had to deal with back then. Now, back then, there were very few services. It was very neglected. In fact, there weren't any programs hardly at all. There's no funding, no research, on and on and on. You know the history. Okay? So to look at, I'm glad she came before me because I'm going to go back for a minute. But to look at her, my heart just swells every time I see her, that how much progress has been made in this country and around the world, but certainly in this country. And that to have our sickle cell patients live into 85, I had trouble getting to 85 myself. So anyway, I just think that it's always good to see her. But I want to read a poem that two of my friends with this program, they interviewed, this was in 1970s, 71 and 72. So they interviewed families to find out what they were going through because they were so neglected, they didn't have any help, there was nothing available, etc. And what they found out, they put into an art form, and they wrote a poem, and I want to read it to you, just to revisit what families were dealing with back then. But you know, everybody doesn't have resources. They don't have access to these resources. So across the country, we have pockets of people with sickle cell disease that probably might be having the same problems that historically they live with. They called it sickle cell disease, the legacy. Nobody ever told me my baby might be born this way. He's in there just crying, poor thing. He's been like this all day. And it's such a hurting thing. I had him to the doctor every time he gets these spells. And just today, though, they told me something's the matter with his cells. First time they said it was a virus. Just let him get some rest. And then they said to bring him back so they could take another test. But when his joints started swelling and I took him in again, they told me it was growing pains. Well, you know, children get them now and then. And the fever. Lord, the fever. He'd be hot as he could be. They kept saying, give him aspirin, give him aspirin. It just didn't seem right to me. It's a hurting thing. Such a hurting thing. We did everything they told us to do. Pills and rubs and bed rest too. But nothing seemed to help him. Seemed there was nothing we could do. Because this is a hurting thing. You know, I guess it might have helped for us to know that we had the trait. But we love this little fellow, and he shouldn't have to wait. And if we hadn't had him, knowing what we do, we'd sure have missed a lot, 'cause he's such a pleasure, too. If we could just be certain that he'll get the chance he should, then maybe all this suffering will work out for the good, 'cause it's such a hurting thing. Isn't that powerful? That describes it. It describes the pain, the crisis, the pain. It described the lack of knowledge. The families didn't know anything. They didn't know what to do. They didn't know what it was. Lack of knowledge of the health providers. Absolutely. Physicians didn't learn. As a physician, I can tell you, in medical school, I didn't learn anything about sickle cell. I've learned all of this as a physician in the ER, okay? But anyway, we see that has really changed. Congratulations. I want to thank Montgomery County for all the things you have done and are doing, and certainly having this every year to put the spotlight on this illness. Thank you all so much.
Thank you very much, Dr. Godston and Mrs. Ricks. We're going to read the proclamation here, and then we're going to all go sign up to give blood and spread the word. Whereas sickle cell disease is a disorder where red blood cells may become sickle-shaped and harden. SCD, as it's also called, is the most common inherited blood disorder in the United States, affecting approximately 100,000 U.S. residents. It is not contagious, and there is no cure.
And whereas September is National Sickle Cell Awareness Month, a time to raise awareness of the disease, African Americans and Latinos have the most common incidence rates of sickle cell disease in the United States. However, many people However, people of many ethnic backgrounds have the disease, and
whereas both parents must carry the sickle cell trait for SCD to develop, voluntary testing is critical to learn a child's risk of inheriting SCD. Early symptoms include yellowing of the skin and eyes, fatigue, and painful swelling of the hands and feet. Early diagnosis and treatment can improve the quality of life for individuals with SCD. And
whereas Montgomery County can be an active part of the solution to treat, manage, and cure SCD by partnering with health organizations to promote research for stem cell transplants, gene therapy, essential medicines, and best practices for healthcare professionals treating patients with SCD. And
whereas sickle cell disease is a global health problem that involves significant health disparities. However, with the collaboration between local, state, and federal governments, we can raise awareness and ensure that treatments are easily accessible to all, giving hope for a better future.
now therefore be it resolved that the County Council of Montgomery County, Maryland hereby declares December as Sickle Cell Awareness Month, and be it further September, I'm ready for Christmas. September as Sickle Cell Awareness Month, and be it further resolved that the power to improve the situation lies within our own communities. Montgomery County residents of African and Latin descent should be tested if they do not know their status, and all residents should advocate for better treatment, awareness, and research of this disease. Presented on this day, the 10th of September, in the year 2024, signed by myself, Councilmember Sayles, Albornoz, and Council President Friedson on behalf of the entire council. Thank you, everybody.